Before I say another word, I want you to hold both hands out in front of you and look at your thumbnails side by side. Don't move on yet. Just look. What I'm about to tell you is going to change what you see when you look at them again tomorrow. Most people over 60 wash their hands a dozen times a day without ever actually looking at them, really looking. But right now, in your hands, is information about what is happening inside your body, information about your nervous system, information about your kidneys, information about whether your brain is getting the nutrients it needs. By the time we finish today, you will have a simple visual assessment you can do in 10 seconds that may prompt one of the most important health conversations you have with your doctor this year. But there is one sign, the fourth one, that I'm saving for last, because it's the one I see most often in patients who have been quietly dismissing symptoms for years. And when I tell you what it looks like, there is a good chance you will realize you have been looking at it every single day without knowing what it meant. I'm Dr. Gerald Mark, and I have spent over 20 years in internal medicine with a specific focus on how the body's visible systems, the skin, the nails, the extremities signal what's happening in the organs you cannot see. Your nails are not decorative. They are a window into your metabolic health, your neurological health, your kidney function, and your nutritional status. After 60, your body's margin for compensation narrows. The reserves that kept everything running smoothly in your 40s and 50s are thinner now. But it does mean that the early warning signs become more important to notice. Research published in major medical journals consistently shows that certain nail changes correlate with systemic health conditions that are far more treatable when caught early. The issue is that they are hiding in plain sight. Your nails grow from a living zone at the base, called the nail matrix, a cluster of constantly dividing cells that sit just beneath your cuticle. These cells are directly connected to your bloodstream, your nerve supply, and your metabolic environment. Every nutrient that enters your system, every waste product your kidneys are trying to clear, all of it flows past the tissue that feeds your nail matrix. Think of your nails like a geological record. When a geologist looks at layers of rock, they can see what was happening to the earth hundreds of thousands of years ago. Your nails do something similar, but on a much shorter timeline. They grow slowly, about 3 millimeters per month, and as they grow, they encode information about your internal environment. A disruption in nutrition 3 months ago may show up as a ridge crossing your nail today. After 60, the peripheral nervous system and the small blood vessels that feed distant tissues like your fingers become more sensitive to deficiencies and dysfunction. And this is where it starts to matter for you personally. The first sign is asymmetric ridging, combined with other neurological changes. Hold both hands in front of you under natural light right now. Look at your thumbnails side by side. Do the vertical ridges look noticeably deeper on one hand than the other? If they do, and if that asymmetry has developed over the past year or two, that is worth noting. When one side of your body begins showing structural changes in the nails, while the other side remains smooth, you are looking at a sign that the nerve supply on that side is under stress. The autonomic nerves that regulate blood flow and sweat gland activity in your fingertips also contribute to the tissue environment of the nail matrix. When those nerve signals become less consistent, nail quality can change in ways that a careful observer will notice. Now, pair that observation with other details. Has your handwriting changed size? Have you noticed a change in your sense of smell? None of these things on their own is a diagnosis, but together, they paint a picture worth discussing with your doctor. I remember a patient I will call Thomas, 68 years old, a retired accountant. His wife had started noticing something odd about 2 years before he came to see me. His handwriting, which had always been precise, had become noticeably smaller. She also noticed that when they walked together, his arm did not swing quite as naturally on his left side. He had also quietly mentioned that food had not tasted or smelled quite the same for the past year or two. Then one morning, his wife looked at his hands and really looked at them. His left thumbnail had developed pronounced vertical ridges. His right thumbnail was smooth by comparison. What Thomas's nails were showing him was the beginning of something his body was trying to communicate through multiple channels: his handwriting, his gait, his sense of smell, his nail quality, all pointing toward the same system. And because he came to me before the story got much worse, we caught something that could have progressed into something far more serious. Early detection of certain neurological conditions changes everything about prognosis and treatment. Thomas's story ended well because we caught it early. If this resonates with you, please subscribe to The Healthy Habit right now. This channel gives you the kind of honest, clear, practical health information that most people only get if they know a doctor personally. Turn on notifications so you never miss a video. Type 1 in the comments if you have noticed ridging that is deeper on one hand than the other. The second sign is horizontal grooves, crossing the width of your nail. These are called Beau's lines grooves that appear when something has disrupted your nail matrix significantly enough to interrupt normal growth. A single groove, after a major illness or serious infection, is completely normal. But recurring grooves, multiple indentations appearing at different heights, or grooves that keep reappearing without an obvious illness to explain them, that tells a different story. This pattern has been documented in medical literature in association with chronic kidney disease. Your kidneys filter waste from your blood, and when they begin to struggle, one of the tissues that shows stress first is your nail matrix. The nail matrix cells divide faster than almost any other tissue in your body, and they are extremely sensitive to waste product buildup in your bloodstream. I had a patient I will call Margaret, 71 years old, who had been noticing a groove crossing her nails on and off for about 3 years. She assumed she had been sick with something she had not fully noticed. What she did not know was that her kidneys had been slowly declining in function. When she eventually came to me for persistent leg cramping and a slight foggy feeling in the mornings, the combination of her nail findings and her symptoms prompted comprehensive testing. Her kidney function was significantly below normal. Early-stage chronic kidney disease was confirmed. But because we found it early, dietary modifications and careful medication management have since stabilized her kidney function at a level her doctor describes as manageable for the long term. Margaret is 74 now. She is still cooking her own meals, still driving herself to her appointments, still living independently. We caught it in time. If you are seeing recurring Beau's lines, that is a conversation to have specifically about kidney function testing. Type 2 in the comments if you have ever noticed horizontal grooves crossing your nails. The third sign is a change in nail shape, specifically nails that begin to curve upward instead of downward. Most nails curve gently downward and follow the shape of your fingertip, but some nails gradually become concave, lifting at the edges and hollowing in the center, like a small spoon. This is called Koilonychia. And in an adult over 60, this shape change is often connected to iron deficiency. Iron deficiency in your age group does not just cause tiredness. It causes neurological symptoms. It affects your ability to concentrate. It can slow your processing speed. It can affect your memory. These are symptoms that are often attributed to normal aging. Think of iron like a master key your brain depends on. Without enough of it, some of the most important systems simply will not open, and over time, you stop noticing what you have lost access to. I had a patient I will call Dorothy, 72 years old, a retired elementary school teacher who had always prided herself on her sharp memory. That ability had started to fade, and it frightened her. She came to me complaining of memory, fog, and fatigue. Several of her nails had become noticeably concave. That spoon shape was unmistakable. Her iron levels came back critically low. She had been on a proton pump inhibitor for reflux for many years, which significantly reduced her ability to absorb iron. Within 3 months of iron supplementation, her memory improved measurably. Her fatigue lifted. Her energy returned. Her nails began to flatten out and return to their normal curvature within 6 months. If your nails have been gradually becoming more concave, and you have noticed any brain fog or fatigue, iron deficiency is worth ruling out with a simple blood test. Before I give you the fourth sign, the one I promised, I want you to do something. Take 10 seconds right now. Pick up your hands. Look at all the signs we have covered so far. Which one are you actually seeing? Drop it in the comments. I read everyone personally, and what you share directly shapes the topics I cover in upcoming videos. Now, the fourth sign. The one I promised you. This is the sign I told you about at the beginning. The one you have probably already seen without knowing what you were looking at. Check right now as I describe it. Look at the base of your thumb, just above the cuticle, where the nail begins. Do you see a pale, whitish, crescent-shaped arc, like a small half-moon? That is your lunula. In a healthy adult, the lunula should be clearly visible on both thumbs. Has yours become smaller or disappeared completely? The gradual disappearance of the lunula has been documented in medical literature in association with B12 deficiency and its downstream consequence of spinal cord degeneration. Vitamin B12 is one of the most critically important nutrients for your nervous system. Without adequate B12, the myelin that sheathes your spinal cord and your peripheral nerves begins to degrade. What makes B12 deficiency particularly dangerous in adults over 60 is that it often develops slowly and silently. After 60, the stomach lining produces less intrinsic factor, a protein essential for absorbing B12 from food. Many common medications taken by older adults, including metformin for diabetes and proton pump inhibitors for acid reflux, further reduce B12 absorption. I had a patient I will call Evelyn, 73 years old, a retired school teacher who told me on her first visit that she was not worried about herself. She was worried about what her grandchildren were starting to notice. She was forgetting recent conversations. She was occasionally unsteady on her feet. Her hands tingled at night. When I examined her hands, both lunulae had completely disappeared. Her B12 level came back critically low. She had been taking a proton pump inhibitor for nearly a decade. With high-dose B12 supplementation delivered initially as injections, her symptoms improved meaningfully over the following months. Her balance returned largely to normal. Her memory fog lifted substantially, and her lunulae began to reappear at the base of both thumbs within 3 months of treatment. That outcome was possible because we found it. And the first thread I pulled was the lunula. Type 4 in the comments if your lunulae have become less visible or have disappeared. Working with patients on exactly this issue, I put together something I call the nail conversation framework. Observe, document, discuss, act. First, you observe your nails with intention. Second, you document what you see with a photograph and notes. Third, you discuss what you have found with your doctor, bringing your documentation with you. Fourth, you act on their recommendation. That simple framework turns vague concerns into specific health conversations. The framework tells you how to think about what you found. Here is exactly what to do with it in the next 7 days. Take your hands to a window with natural daylight right now and spend 2 minutes looking at your nails. If you see any of the 4 signs, take a close photograph of both hands. Write down specifically what you found, which nails, which hand, how long you have noticed it. Pair it with any other symptoms, fatigue, memory fog, balance changes, or tingling. This week, if you found 2 or more of these signs, call your doctor's office. Do not wait for your annual physical. Ask for B12 levels, complete blood count including iron studies, basic metabolic panel for kidney function, and if you found neurological signs, ask for a neurological screening. Bring your photographs and notes with you to your appointment. Asymmetric ridging, especially paired with handwriting or gait changes, deserves a conversation about your nervous system because early detection here changes everything about prognosis. Recurring horizontal grooves warrant kidney function testing because chronic kidney disease in its early stages is almost entirely silent. Nails becoming concave should prompt iron studies because the cognitive symptoms of iron deficiency are frequently mistaken for normal aging. And disappearing lunulae combined with any tingling, balance changes, or memory fog should lead directly to B12 testing because B12 deficiency is reversible when you find it in time and potentially irreversible when you do not. Most people your age will scroll past information like this without a second thought. But you are not most people. You made a choice today that most people around you will never make. I want to thank you for the time you just spent learning something that could genuinely change how you approach your health. You now have something most people do not, the ability to read your own body's language. You know what to look for, and you know exactly what to do with what you find. You are equipped in a way most people around you are not. Share this video with one person over 60 in your life whose health you care about. Subscribe to The Healthy Habit and turn on notifications so you never miss a video like this one. Look at your lunulae right now and tell me what you see. Are they clearly visible on both thumbs, or have they started to fade? Small habits, done consistently, are the most powerful medicine your body will ever receive. I'm Dr. Gerald Mark. Build one healthy habit today, and I'll see you in the next one. Everything I have shared today is for general informational purposes only, based on published research and clinical observation. It is not a personal diagnosis, and it is not a substitute for care from your own doctor. Please consult your physician or a qualified healthcare provider before making any changes to your medications, diet, supplements, or health routine.